Hello everybody, my name is Marcus Sauter. I want you guys to imagine something for me. I want you to imagine your closest co-worker going in cardiac arrest. Would you guys know what to do? Would you guys know how to do hands-only CPR? Would you guys know how to use this automatic external defibrillator? I'm going to show you two things today. I'm going to show you first how to do hands-only CPR. Second, I'm going to show you how to use this automatic external defibrillator. You may not think this is going to happen here on base or around you at home or out in the public, but according to heart.org article titled about cardiac arrest in 2014, cardiac arrest in public happens 420,000 times a year here in the United States alone. I'm going to show you one of those times here on this video up on my TV. I'm going to show you a Sylvania school teacher walking her second grade classroom down to the Christmas program, and she goes into cardiac arrest. I want you to watch as the teachers respond and watch what the teachers do. Here's Liz right here. She can tell she's not feeling good. She's going to lean against those lockers and she's going to collapse. She collapses and she goes into cardiac arrest. That means her heart's not beating and she's not breathing. You can see the other teachers respond. They're calling 911, telling someone to call 911. But what they fail to do, they fail to start CPR. They fail to get the AED in their school. And they fail to help Liz out. You may not think that's important because the fire station will be there soon, but believe it or not, for every minute that someone in cardiac arrest doesn't get CPR, it decreases their chance of survival by 10%. 10%, that's huge. It usually takes us as a fire department 5-8 minutes to get to the scene. So you take those numbers, times them by 10, that's 50 to 80% of the chance of survival decreases because of response times. Luckily enough for Liz, we were only right down the street when this happened, so we got there within like a minute and a half. You can see us come and we saved the day. We take Liz off to the hospital, and believe it or not, she survives her cardiac arrest. So I'm going to show you two things. First, we're going to start off with hands-only CPR. And then we're going to move on to the automatic external defibrillator. For someone in cardiac arrest, we're going to come up to the patient. We're going to look, listen, and feel for breathing. No breathing. We're going to move down to their neck. Look, listen, and feel their neck. If their neck's not pulsating, we're going to start chest compressions. One hand in the middle of the chest, in between the nipple line, interlock it with the other hand and start chest compressions at a rate of 100 per minute. We want to go down to the depth of 1.5 to 2 inches, and we want to continue this until we're too tired to continue, somebody takes over, or EMS arrives. Now we're going to move on to the second step. And the second step is the AED. The AED is very important because according to the 2011 article, shockable cardiac arrests are more common in public than home. More than 1/3 of the people treated with an AED in public survived their cardiac arrest. That's 33%. That's huge. That's before firemen, policemen, paramedics are getting on scene. Lay people, just as yourselves, are taking the initiative to use this machine along with the CPR they learn in treating a victim. That's a really good job. So for the AED, we're going to open it up. We're going to turn the machine on. Very simple. It only has 3 buttons. And we're going to take these electrodes, there's 2 of them, and we're going to attach them to our patient. The electrodes tell exactly where they go. We want to expose our patient the best we can. We want to remove any necklaces any bras with underwires that will conduct electricity and burn our patient. If the patient's in a puddle of water, of course we want to remove the patient and dry him up best we can because water conducts electricity. I'm going to apply my electrodes.
Connect electrodes. Push.
And then I'm going to push this analyze button, the yellow button on this machine, and the machine's going to take over. It's going to tell me to stop doing CPR and stand clear.
Stand clear.
We're standing clear. The machine's doing its job. It's going to look to see what kind of heart rhythm the patient is in. Now it's charging up because the patient needs a shock.
Stand clear. Push to shock.
I'm going to make sure everybody's not touching the patient, and I'm going to hit the shock button. My energy's delivered. Hopefully the patient came back to life. If not, we're going to continue CPR, and the machine's going to recycle and want to do this whole process again in 2 minutes. We're going to continue doing CPR, like I said, at a rate of 100 1.5 inches to 2 inches down in depth, and we're going to continue it till I'm too tired or EMS arrives. Someone called EMS, and we're going to move on from there. And that's how we're going to save somebody's life. You as a layperson with very little training can save somebody's life. You may think, this is never going to happen to me. I'm a healthy person. But according to the 2000 article from the Journal of American Medical Association titled Improving Survival from Sudden Cardiac Arrest, most people that suffer from cardiac arrest never had any signs of serious heart disease. Never had any signs. They just dropped dead. What do you think about that? So hopefully, with you learning hands-only CPR today and learning to use this AED, we increase someone's survival rate. Hopefully you will take action and use this in saving somebody's life. Thank you.